So for many of us, the word cancer, especially if it's used on ourselves or with respect to a loved one, makes our blood run cold. It's really a fear of the unknown. What caused it? Could it have been prevented? Are there tests? Are there effective treatments? Will I or my loved one die? But while there may be many unknowns in the world of cancer prevention, diagnosis, and treatment, there is a great deal that is known about cervical cancer, which globally claims the lives of more than 350,000 women each year. We know that it's one of a handful of cancers understood to be caused by a virus, in this case, the human papillomavirus. We know that there are effective vaccines, tests, and treatments. And we know that these factors make cervical cancer the first cancer to be considered possible to eliminate. I'm Catherine Bliss, Senior Fellow with the CSIS Global Health Policy Center in Washington, D.C., and welcome to today's discussion about the opportunity to eliminate cervical cancer in the region of the Americas. Now, of the 40,000 women in the region who die from cervical cancer each year, more than 80% live in Latin America and the Caribbean. The highest burden is in countries and communities with the least resources. In 2018, the region adopted an ambitious plan to eliminate cervical cancer. And through it, governments recognized that without multi-sectoral action to improve equitable access to prevention, testing, and treatment, cervical cancer cases and deaths in the region would increase dramatically thanks to population growth, demographic shifts, and behavioral change. Can the Americas become the first region in the world to eliminate cervical cancer or any kind of cancer? Let's find out. I'm very pleased to introduce Jarbas Barbosa, Director of the Pan American Health Organization, Violaine Mitchell, Director of Immunizations at the Bill and Melinda Gates Foundation, and Monica Garcia, Minister of Health from Spain. Let's dive right in. We have a short period of time. We could spend days on this topic, but let's get started. So Dr. Barbosa, let's start with you. We've already lost a generation of women to cervical cancer. There are still 40,000 deaths in the region each year, but there are now highly effective vaccines, HPV tests, the self-tests, and effective treatments if the cancer is detected in time. So why have you prioritized cervical cancer elimination during your tenure as PAHO director? And what makes you optimistic that it is possible to eliminate cervical cancer across the region and really protect future generations?
Thank you, Catherine. I think that I am optimistic because first, we have a long-standing history in this region of leading the world to eliminate diseases. We were the first one to eliminate polio, measles, and other diseases. Second, I think that we have a very strong commitment from our member states. We already have 48 countries and territories in the Americas that are using HPV vaccine. Only 3. We are missing only 3 that will get them on board until next year. In this region, 94% of the girls live in a country that have access to HPV vaccine, mostly because you have a PAHO's revolving fund offering a vaccine, high-quality vaccine by an affordable price. But we also are seeing that many countries are already establishing national plans. Ministers are making commitment. So I think that we can really be the first region in the world to eliminate cervical cancer. It's not possible that having the tools and the strategies that we cannot eliminate a disease that every day, 100 women die of cervical cancer in Latin America and the Caribbean. And as you mentioned, it's not a random number. We have these women are women that live in the slums, in the big cities, rural areas, women from indigenous populations. So I think that for a public health perspective, but also to promote equity, I think that is an obligation to embrace this cause.
So you've really talked about the importance of new technologies, innovative tools, but also national plans and regional solidarity, and really bringing those 3 elements together. Minister Garcia, I want to turn to you. Spain has really placed a great deal of emphasis on improving access to cervical cancer prevention and treatment in domestic programs. And Spain is also focusing on international challenges, including by making a series of commitments at the first Global Forum on Cervical Cancer Elimination this past March in Cartagena in Colombia. So could you say a little bit about how Spain is leveraging its own expertise and resources to support cervical cancer elimination in the region of the Americas?
Okay. Thank you very much for the invitation. Thank you very much, Catherine. For Spain, cervical cancer represents a global public health issue that requires coordination, action among countries based on cooperation and the recognition of our interdependence. Better global health means better health in each countries, and that's why we collaborated with the government of Colombia in organizing the first World Forum for the elimination of cervical cancer held in Colombia. This event allowed us to bring strategies to the table to eliminate cervical cancer globally and reach commitments for collaboration with the WHO 2020 elimination strategy. So, as part of this commitment and the Spain Global Outlook, we will contribute through the Spanish Agency for International Development Cooperation with 10 million euros over the coming years to help improve vaccine coverage, train healthcare professionals, and enhance prevention and early detection efforts. To advance the elimination of cervical cancer, we need to focus in three key areas. First, improving vaccination coverage, of course, such as through the single-dose strategy proposed by the WHO were implemented and incorporating men into this program. Second, increasing participation in early detection programs to offer effective health care for the population. And third, last but not least, reducing health inequalities, because that affect vaccination coverage, participation in screening programs, and health outcomes. We believe that such meetings and partnerships are essential to ensure that the progress we make toward elimination cervical cancer has a global impact and also reduce disparities between countries. To improve global health, we need spaces like this, where governments, civil society, donors, and multilateral institutions can come together, making collaboration as effective as possible and ensuring it reaches all people worldwide. Without this cooperation, achieving the elimination goal would be more difficult, both globally and nationally.
So you've really talked about the importance of addressing inequities within countries, but also some of the imbalances that we see between countries and between regions, and really using the new tools that we have to remedy those disparities. Violaine Mitchell, let me turn to you. You know, both Dr. Barbosa and Minister Garcia have raised the importance of really looking at equity as an aspect of the elimination program. And you know, as we see in the Americas, not only is it the populations in some of the lowest income countries that are struggling with the burden of cervical cancer, but even in the middle and high income countries in the region, we see pockets of inequality and disparities that really make the elimination agenda a challenge. And so I wanted to ask you, from your perspective with the foundation, to say a bit about the ways in which we can begin to ensure equitable access to some of these new tools, and the role that partnerships can play in doing so.
Right. Well, first off, thank you, Catherine, very much, and thank you to PAHO for inviting me. This is a subject we are deeply passionate about, and for me personally as well. I think I'd like to make 3 points, if I may. The first is that cervical cancer elimination is doable. This isn't a pipe dream. This is something we absolutely can do. We have a highly effective vaccine, more than 95% efficacious. We have a recommendation from the WHO, from PAHO in 2023 for a single dose vaccine. We have 58 countries who've now adopted this, including in the region, Mexico. We have brand new diagnostics coming down the pike, and already in use, as well as treatment programs. So this is utterly doable within our reach. The second point I'd like to make is actually a thank you to PAHO and the PAHO region. Dr. Barbosa, you noted the pathfinder role the Americas have played, but I think back to smallpox, to polio, to measles. PAHO set out in the Americas what actually became what the rest of the world emulated. So I really believe that this movement of cervical cancer elimination is timely. I had the privilege of being in Cartagena at the first Cervical Cancer Forum. I really want to thank PAHO, the governments of Spain and Colombia, for hosting this with WHO, UNICEF, many partners. This was extraordinary, and really pleased that the government of Indonesia has stood up now to actually invite the world to Indonesia next June. But I think what Cartagena was also so unique about was bringing together the cancer and vaccination immunization communities, and embarrassingly, I might say, for the first time. So a tremendous milestone. And then the third point I'd like to make is, maybe for many of you in the room, you know, but cervical cancer is a horrendous disease. It is painful, it is terrible. It cuts women down in the absolute prime of their lives. It leaves maternal orphans, it leaves families devastated and communities without valuable members. It's absolutely ridiculous. It's horrendous what actually this disease has done and does every day, with 100 women dying each day. But what do we do? And this is where I think, to your question about partnership, it is about partnership, about what each and everyone can bring. National governments, civil society, foundations like ourselves, multilaterals. Collectively, the private sector is critical, but working together, we really can absolutely make this a thing of the past. And I think in terms of equity, there is nothing that is going to advance equity more than ensuring that the women we're losing today, 350,000 women globally, never die in the future. So thank you.
So all of you have, in one way or another, really touched on the history and the legacy of the important disease elimination campaigns of the past around smallpox in particular. And PAHO, of course, has played such a strong role. I mean, the region of the Americas, has been a leader in not just with smallpox, but polio and measles elimination and so many others. And Jarbas Barbosa, I wanted to start with you, just to say a little bit more, if you would, about some of the lessons from the elimination campaigns really over the past 70 or so years. Many of them have been successful, but there have been some challenges as well, and what, not necessarily just in this region, but globally. And so what lessons can be taken from some of those historical examples that can be relevant for this moment?
It's a very good question, Catherine. I think that first we need to have the political commitment. So I think that I'm very happy when I see that the countries like El Salvador, a small country in Central America, receiving devices that will allow the primary health care to be performing the ablative treatment for women. I'm very happy when I see that 25 countries in our region are already following the recommendation to move it to one dose regime of HPV. And they are not reducing the volume of vaccines. They are vaccinating more. They are vaccinating boys, for instance. But we have some challenges, and partnerships are very important. The new tests that you mentioned, and these tests are a game changer because it's much better test. They can be used as a self-test, so this will remove a huge barrier for the women. Only 10 countries are using this test in the region. Why? Because most countries cannot afford the current price that the producers are charging for this test. So if we don't have this kind of commitment from not only the government, the societies, the private sector, I think that we can move forward and can make, I think, that this very important achievement for the women and the families, communities in our region, that is to eliminate cervical cancer.
So you've raised, 2 points that I think are important across many of the different lessons, or 3 really. I mean, the importance of partnerships between organizations like WHO, national governments, and civil society. Also the important role of financing, but at the same time, really understanding how people will use technologies, or how, what is comfortable for people to use, what women will be able to access and be able to use on a routine basis. Minister Garcia, let me ask you what you see as some of the important lessons that can be relevant in this particular moment.
I think when we want to evaluate the progress of our efforts in eliminating cervical cancer, we need to set both short-term and long-term goals. No? It's different. First, we need to assess whether the resources we allocate are improving our vaccination coverage at the last at least 1 dose, aiming to reach as many cohorts as possible, always with as you said, the equity-focused approach. We know, and you told, that in general people with lower incomes participate less in preventive activities, whether in screening programs or vaccination programs. Therefore, any elimination strategy must assess in success by considering the impact on reducing health inequalities. In Spain, for example, in the last 10 years, we have a percentage of 15 years girls who had received the recommended dose of HPV vaccine from 58% in 2012 to 80% in 2022. So, and now we are vaccinating men since 2023. Another short-term goal is to improve participation in cervical cancer screening program, and we have to improve that. No? And in the long term, the goals we need to set include achieving optimal coverage levels with the complete HPV vaccination schedule. Secondly, ensuring comprehensive follow-up to that women, and comprehensive care for those who require more specific attention with the healthcare system. So these 3 pillars are essential to advancing for elimination the cancer, and we need to study the barriers to remove the barriers present in each country. For this reason, the participation of civil society, the patients are crucial, and they provide us with this perspective, a space like the World Forum for the Elimination of Cervical Cancer allows us to come together and share experiences and learn from the others, from other countries. We need such spaces to understand the best strategies to implement in order to advance both vaccination coverage and screening programs.
So you've really, pointed out the importance, not just of having very strong targets and goals that can be, measured and really kind of compared across different regions or different geographies, but also in some cases the importance of tailored approaches depending on people's needs and, really in order to improve equity. We're getting very close to our time, but Violene Mitchell, let me ask you if you could say a little bit about, as we look at some of the lessons across the different elimination agendas, policy recommendations that we can really kind of mobilize to look ahead.
So thank you, and I mindful of time and also recognize the tremendous interventions from my colleagues here. I would say, on the policy, it's continuing to execute against the single-dose policy. But I think what I would also say is Dr. Cira de Quadros, who ran the immunization program in the Americas for many years, personal hero of mine, and the late Cira de Quadros. But when it came to polio and measles, when people were frustrated and it couldn't be done, he just said, focus, we have everything we need, just get it done. And I feel that's where we are with cervical cancer elimination. Let's not put up barriers, let's take them down.
So we know what we have the tools that we need. We know what we need to do.
And we can do it.
We just need to get it done. Okay. I hope you'll agree with me that we've heard compelling insights and energy and motivation about the persistent challenge of cervical cancer in the Americas and the real opportunity at the intersection of technological innovation, policy innovation, and funding commitments to advance the regional elimination agenda. I want to thank our speakers, Jarbas Barbosa of the Pan American Health Organization, Monica Garcia from the Spanish Ministry of Health, and Violaine Mitchell from the Gates Foundation for sharing their views on how we can turn this ambition and opportunity into a reality. And thank you for joining the conversation.
Great.